So in the context of your trial, these were these high-risk patients that got the neoadjuvant. And I think that the struggle, and we see it in other disease sites in urology, is we're trying to balance both intensifying therapy for our high-risk patients and de-intensifying the burden of therapy for our low-risk patients. So, I think the risk historically has been that everyone gets a nephroureterectomy, whether you have very high-risk disease that arguably needs more, or lower-risk disease which actually needs less therapy. And that maybe leads into our next topic, which is your ongoing work looking at VTP, and this is a way of nephron sparing or organ preserving for patients with upper tract disease. So can you tell us a little bit about maybe the phase 1 data that's come out so far, and then the ongoing phase 3 trial?
Yeah, so we've been interested in trying to develop therapies that we can use to treat upper tract cancers. As we mentioned before, the limitations we have with instrumentation are pretty significant, and we can't resect tumors very well endoscopically. We can't reach all areas endoscopically, and the laser-based therapies that we have right now are limited in terms of what they can do, and also some of the damage that can be caused with them if they're not used properly. As many people know, there's therapies like mitomycin gel or gel-mito that can be used in the upper tract that's been effective, but not in all patients. And so we're all looking to try and find new types of therapies that we can use in the upper tract to treat cancers effectively. Photodynamic therapy is a therapy which has been developed in the past for endoscopic use, either in the esophagus for Barrett's esophagus changes, or for in the bladder, even for bladder cancer back in the 1980s, it was developed for that use. Along comes this new therapy, which is called vascular-targeted photodynamic therapy, which has an advantage of the drug being only in the vascular system, so it doesn't enter into the cells. So phototoxicity for patients is not really an issue. The drug washes out within 6 hours, essentially, and so patients can leave the hospital on the same day, and they don't have to worry about long-term phototoxicity. So we adapted it for use in the upper tract. We did a lot of preclinical studies in our lab looking at its use in animal models of urothelial cancer. We did a lot of large animal studies to show that it was safe to use in the upper urinary tract, and then we developed that into a phase 1 trial where we treated 18 patients altogether, and we showed roughly about 50% of those patients, or a little bit more than 50%, actually responded to therapy, including some patients with complete response, even in patients with even high-grade cancers. And this was just a single treatment, so it wasn't multiple therapies that were being provided. Although a few patients did receive more than one treatment, some received up to 2. So that preliminary data has been used now to develop a phase 3 trial, which is now a multi-center phase 3 being run at sites throughout the United States, Europe, and Israel. And this is a trial where patients come in, they receive the drug intravenously at the time of their procedure. We look up inside the kidney, and then when we see tumor, we place a small laser fiber in proximity to where the tumor is. And after the drug is completed infusion, we turn on the laser fiber, and it's a diffuser fiber. It kind of looks like what you'd expect from a fluorescent light bulb, if you will. It lights up very brightly, and it basically bathes the entire interior of the renal pelvis with near-infrared light. So that near-infrared light can penetrate into the tissues to a depth of several millimeters and can treat tumors fairly effectively. In the phase 1 trial, as I said, it was roughly effective in about 50 to 60% of cases. And now we're looking at treating patients right now in the Enlighted trial. It's low-grade patients, low-grade upper tract cancers in the renal pelvis or in the ureter. But there is also a plan right now in place for a similar trial for patients with high-grade upper tract disease, which I think could be a game changer in terms of some of the patients that we see, because many of us have patients with solitary kidneys, some of them with Lynch syndrome and others, where they're looking to hold on to their kidneys in the setting of high-grade upper tract cancers. And we don't have a lot of other effective therapies that can work in that scenario.